What does psychosomatic mean? The term psychosomatic refers to the interaction between the mind, psyche, and the body, soma, and how psychological factors can influence physical health. It is used to describe physical symptoms or illnesses that are thought to be primarily caused or exacerbated by psychological or emotional factors, such as stress, anxiety, or unresolved emotional conflicts. In psychosomatic medicine, healthcare professionals consider the role of a person's mental and emotional state in the development, progression, and treatment of certain medical conditions. Psychosomatic symptoms are real physical symptoms that have a psychological origin. These can manifest as various physical conditions, such as headaches, digestive problems, skin conditions, and even more serious illnesses. The idea behind psychosomatic medicine is to recognize the connection between a person's emotional well-being and their physical health, and to provide holistic care that addresses both aspects. This can involve therapies like cognitive behavioral therapy, relaxation techniques, and stress management to help improve the patient's overall well-being and alleviate or manage their physical symptoms. What is a psychosomatic disorder? A psychosomatic disorder is a medical condition in which psychological factors play a significant role in the development, exacerbation, or maintenance of physical symptoms or illnesses. These disorders are characterized by the presence of real and often distressing physical symptoms that cannot be fully explained by a known medical condition or pathology. Instead, the symptoms are believed to be primarily related to psychological or emotional factors. Psychosomatic disorders are also sometimes referred to as psychophysiological disorders or somatic symptom disorders. They can take various forms and may include symptoms like chronic pain, fatigue, gastrointestinal problems, and neurological symptoms. Common psychosomatic disorders include 1. Somatization disorder. This involves a history of multiple, recurrent, and diverse physical symptoms that are not fully explained by any underlying medical condition. 2. Conversion disorder. In this disorder, psychological stress is thought to be converted into physical symptoms, often affecting a person's ability to move or sense certain parts of their body. 3. Hypochondriasis, now known as illness anxiety disorder. Individuals with this condition have excessive worry about having a serious illness, despite medical reassurance and a lack of medical evidence to support their concerns. 4. Somatic symptom disorder. This involves experiencing distressing physical symptoms, such as pain or fatigue, that are significantly related to psychological factors and can cause impairment in daily life. 5. Functional neurological symptom disorder. Previously it was referred to as hysterical neurosis or conversion disorder. It involves neurological symptoms that cannot be explained by medical tests and are believed to have a psychological origin. It's important to note that psychosomatic disorders do not imply that the symptoms are all in a person's head, or that the person is intentionally creating the symptoms. These symptoms are genuine and can be quite distressing. Treatment for psychosomatic disorders typically involves a combination of medical evaluation to rule out underlying physical causes and psychological therapies to address the emotional and psychological factors contributing to the symptoms. Psychosomatic disorders often benefit from a holistic approach that considers both the physical and emotional aspects of a person's health. How common is somatic symptom disorder? Somatic symptom disorder is relatively common in clinical settings, and it affects a significant portion of the population to varying degrees. Its prevalence can vary depending on the specific population studied and the criteria used for diagnosis. The prevalence of somatic symptom disorder is estimated to be around 5% in primary care settings, where individuals often first seek help for their physical symptoms. It tends to be more common among patients with chronic medical conditions and those with complex or unexplained symptoms. It's important to note that somatic symptom disorder exists on a spectrum, and not everyone who experiences distressing physical symptoms has a diagnosable disorder. Many people experience somatic symptoms related to stress, anxiety, or emotional distress without meeting the diagnostic criteria for a somatic symptom disorder. While somatic symptom disorder can significantly impact a person's quality of life, it can often be effectively managed through a combination of medical evaluation, psychotherapy, and support. Treatment strategies often focus on addressing the underlying psychological and emotional factors that contribute to the distressing physical symptoms. The specific approach to treatment may vary depending on the individual's unique circumstances and needs. Who might have somatic symptoms? Somatic symptoms are common experiences, and many people may have mild or occasional somatic symptoms without having a somatic symptom disorder. Somatic symptoms can be seen in a wide range of individuals, and they can vary in intensity and duration. Some factors that might contribute to somatic symptoms include 1. Stress and anxiety. Stress and anxiety are among the most common triggers for somatic symptoms. Individuals under stress or experiencing high levels of anxiety may develop physical symptoms like tension headaches, muscle pain, or gastrointestinal discomfort. 2. Medical conditions. People with various medical conditions may experience somatic symptoms. These symptoms can be related to the primary medical condition or be side effects of treatments. 3. Trauma. Individuals who have experienced physical or emotional trauma may develop somatic symptoms as part of their psychological response to the trauma. This can manifest as pain, numbing, or other physical sensations. 4. Grief and loss. The grieving process can also lead to somatic symptoms. People who have lost a loved one may experience physical symptoms such as a heavy feeling in the chest or fatigue. 5. Preoccupation with health. Some individuals may have a heightened focus on their health and may worry excessively about their physical well-being. This can lead to increased attention to physical sensations and the development of somatic symptoms. 6. Personality traits. Certain personality traits, such as neuroticism, may be associated with a higher likelihood of experiencing somatic symptoms. 7. Cultural and social factors. Cultural beliefs and social norms can influence the expression and perception of somatic symptoms. In some cultures, there may be a greater emphasis on physical symptoms as a way to express emotional distress. It's important to note that experiencing somatic symptoms is not unusual, and they do not necessarily indicate a somatic symptom disorder. Somatic symptom disorder is diagnosed when the symptoms are severe, persistent, and significantly disrupt a person's daily life. When somatic symptoms become chronic and disabling, and there is excessive worry about them, it may be appropriate to seek evaluation and treatment from a healthcare provider or mental health professional. Treatment often involves addressing the underlying psychological factors contributing to the symptoms and providing appropriate support and coping strategies. How can psychosomatic disorder affect my body? Psychosomatic disorders can affect your body in various ways, as they involve the interaction between psychological factors and physical health. When psychological factors, such as stress, anxiety, or emotional distress, play a significant role in the development and course of physical symptoms or conditions, it can have a range of effects on your body. Here are some ways in which psychosomatic disorders can impact your body. Physical symptoms. You may experience real, distressing physical symptoms that can vary widely and affect different parts of your body. These symptoms may include headaches, digestive problems, pain, fatigue, and various other sensations. Chronic pain. Psychosomatic disorders can lead to chronic pain conditions, such as tension headaches, migraines, or unexplained musculoskeletal pain. The pain may be persistent and debilitating. Gastrointestinal issues. Stress and emotional factors can contribute to gastrointestinal problems, like irritable bowel syndrome, IBS, indigestion, and functional dyspepsia. Cardiovascular effects. Long-term stress and anxiety can lead to increased heart rate, elevated blood pressure, and a higher risk of cardiovascular problems. Immune system suppression. Prolonged stress and emotional distress can weaken the immune system, making you more susceptible to infections and illnesses. Sleep disturbances. Anxiety and emotional factors can lead to sleep disturbances, including insomnia or disrupted sleep patterns, which can have further negative impacts on physical and mental health. Neurological symptoms. In some cases, psychosomatic disorders can manifest as neurological symptoms, such as numbness, tingling, or weakness in the limbs, without any organic neurological cause. Aggravation of existing conditions. Psychosomatic factors can exacerbate pre-existing medical conditions, making them more difficult to manage and control. Impaired coping mechanisms. Emotional distress can hinder your ability to cope with and manage physical symptoms effectively. Impact on overall well-being. Psychosomatic disorders can significantly affect your overall quality of life, leading to increased stress, reduced functioning, and impaired social and occupational functioning. It's important to note that the mind-body connection is complex, and the effects of psychosomatic disorders can vary from person to person. The specific symptoms and their severity will depend on individual circumstances and the nature of the underlying psychological factors. Seeking appropriate medical and psychological care is essential for managing and addressing psychosomatic disorders and their impact on your body. Treatment often involves a combination of medical evaluation, psychotherapy, and lifestyle changes to address both the physical and emotional aspects of the condition. What causes psychosomatic symptoms and illnesses? The causes of psychosomatic symptoms and illnesses are complex and multifaceted, often involving an intricate interplay of psychological, emotional, and physical factors. While the exact cause can vary from person to person, here are some common contributing factors to psychosomatic symptoms and illnesses. 1. Stress and anxiety. High levels of stress and anxiety are major triggers for psychosomatic symptoms. The body's stress response can lead to physical changes, such as increased heart rate, muscle tension, and altered immune system functioning, which can manifest as physical symptoms. 2. Emotional distress. Unresolved emotional issues, such as grief, trauma, or conflict, can lead to the development of physical symptoms. The mind and body are closely connected, and emotional distress can be expressed through physical sensations. 3. Personality factors. Certain personality traits and coping styles can make individuals more prone to somatization, where emotional distress is converted into physical symptoms. For example, people with high levels of neuroticism may be more susceptible. 4. Cultural and social influences. Cultural norms and social expectations can influence the expression of emotional distress. In some cultures, it may be more acceptable to express emotional pain through physical symptoms. 5. Medical conditions. Individuals with chronic medical conditions may experience psychosomatic symptoms related to their underlying health issues or the stress of managing those conditions. 6. Trauma and past experiences. Previous traumatic experiences or a history of abuse can contribute to the development of psychosomatic symptoms as a way to cope with or express emotional pain. 7. Health beliefs and belief systems. Personal beliefs about health and illness can shape how physical symptoms are perceived and expressed. For example, someone with a strong fear of illness may be more likely to interpret physical sensations as signs of a severe condition. 8. Cognitive factors. Maladaptive thought patterns and cognitive distortions can influence the perception and experience of physical symptoms. Catastrophic thinking or excessive worry can exacerbate somatic symptoms. 9. Genetics and biological factors. There is some evidence to suggest that genetics and biological factors may play a role in somatization tendencies. 10. Psychological disorders. Conditions such as anxiety disorders, depression, and somatic symptom disorders can increase the likelihood of experiencing psychosomatic symptoms. These disorders often involve a complex interplay of psychological and physical factors. It's important to note that psychosomatic symptoms and illnesses are not a form of malingering or intentional deception. The symptoms experienced are real and distressing to the individual. The mind and body are interconnected, and psychosomatic symptoms represent a complex interaction between emotional and physical health. Treatment for psychosomatic symptoms typically involves addressing the underlying emotional factors through therapies like cognitive behavioral therapy, mindfulness, relaxation techniques, and stress management. A comprehensive approach, which may include medical evaluation, is often necessary to address the symptoms and their underlying causes. What are the signs and symptoms of psychosomatic illnesses? Psychosomatic illnesses are characterized by physical symptoms that are primarily influenced by psychological and emotional factors. The symptoms are real and often distressing to the individual, but they cannot be fully explained by an underlying medical condition or pathology. Common signs and symptoms of psychosomatic illnesses may include 1. Pain. This can be in the form of headaches, back pain, muscle pain, joint pain, or other types of chronic pain. The pain may be diffuse, migratory, or localized. 2. Gastrointestinal symptoms. These can include abdominal pain, bloating, diarrhea, constipation, or other digestive discomfort. Individuals with psychosomatic disorders may often be diagnosed with conditions like irritable bowel syndrome, IBS. 3. Respiratory symptoms. Some people may experience breathing difficulties, shortness of breath, or chest pain, which may mimic respiratory conditions but lack a clear medical cause. 4. Cardiovascular symptoms. Individuals may have increased heart rate, palpitations, or elevated blood pressure due to stress and anxiety. 5. Neurological symptoms. These can include numbness, tingling, or weakness in various parts of the body. These symptoms may resemble neurological conditions but lack objective medical findings. 6. Skin conditions. Stress and emotional factors can exacerbate or contribute to skin problems like hives, rashes, or eczema. 7. Fatigue. A pervasive and unexplained sense of tiredness and fatigue is common in psychosomatic disorders. 8. Sleep disturbances. Sleep problems, such as insomnia or disrupted sleep patterns, are frequently seen in individuals with psychosomatic symptoms. 9. Cognitive symptoms. Some people may experience cognitive difficulties, such as difficulty concentrating, memory problems, or a feeling of brain fog. 10. Sexual dysfunction. Psychosomatic factors can contribute to sexual problems, including loss of libido, erectile dysfunction, or pain during sexual activity. 11. Sensory disturbances. Changes in sensory perception, such as heightened sensitivity to pain or unusual sensations, may be present. 12. Psychological distress. Symptoms of anxiety, depression, and emotional distress are often intertwined with physical symptoms in psychosomatic disorders. 13. Health anxiety. Individuals may have excessive worry about their health and persistently fear the presence of a serious medical condition, despite medical reassurance. 14. Functional impairment. The physical symptoms can lead to functional impairment in daily life, affecting work, relationships, and overall quality of life. It's important to emphasize that these symptoms are not fabricated. Individuals with psychosomatic illnesses genuinely experience them. The challenge lies in determining the underlying psychological factors contributing to these symptoms and providing appropriate treatment. A comprehensive approach that combines medical evaluation and psychotherapy, such as cognitive behavioral therapy, is often effective in managing and alleviating psychosomatic symptoms. The goal of treatment is to address both the physical and emotional aspects of the condition and improve the individual's overall well-being. Sex and age. Do psychosomatic symptoms differ in people based on their sex and age? Yes, psychosomatic symptoms can vary among individuals based on their sex and age. While the fundamental mechanisms underlying psychosomatic symptoms remain similar, there are differences in how these symptoms manifest and the types of conditions that may be more common in specific age groups and sexes. Here are some general considerations for how psychosomatic symptoms can differ based on sex and age. Age-related differences. Children and adolescents, younger individuals may manifest psychosomatic symptoms differently. Children may express emotional distress through behaviors such as stomach aches, headaches, or other unexplained physical complaints. Adolescents might experience symptoms related to academic stress, peer pressure, or identity issues. Young adults, stressors related to the transition to adulthood, such as educational and career pressures, can contribute to psychosomatic symptoms in young adults. Conditions like somatic symptom disorder or health anxiety may become more prominent during this stage. Middle-aged adults, career demands, family responsibilities, and the challenges of midlife can lead to psychosomatic symptoms, such as gastrointestinal issues, cardiovascular symptoms, and chronic pain conditions. Elderly adults. Older individuals may experience psychosomatic symptoms related to grief, loss, loneliness, or medical comorbidities. These symptoms can manifest as physical discomfort, cognitive difficulties, and sleep disturbances. Sex-related differences. Women may be more likely to experience certain psychosomatic symptoms, such as migraines, tension headaches, and disorders like fibromyalgia and irritable bowel syndrome. Hormonal changes associated with the menstrual cycle, pregnancy, and menopause can influence symptom expression. Men may also experience psychosomatic symptoms but may be less likely to seek medical or psychological help for emotional distress. They may manifest symptoms such as chronic pain, cardiovascular symptoms, or gastrointestinal issues. Health anxiety. Some individuals, regardless of sex, may develop health anxiety and excessive worry about their health. This can lead to heightened attention to physical symptoms and frequent medical consultations. It's essential to recognize that psychosomatic symptoms can affect people of all ages and sexes, and the expression of these symptoms can be influenced by various individual and environmental factors. Healthcare providers and mental health professionals need to consider these factors when evaluating and treating psychosomatic symptoms, tailoring their approach to the specific needs and circumstances of each individual. Additionally, the treatment approach for psychosomatic symptoms may need to account for these variations in symptom presentation. Psychogenic versus psychosomatic pain. Psychogenic pain and psychosomatic pain are related concepts, but they refer to slightly different types of pain, each with distinct underlying causes and characteristics. Psychogenic pain. Psychogenic pain is pain that is primarily attributed to psychological factors, such as emotional distress, trauma, or mental health conditions, without an evident physical cause or pathology. The pain experienced is perceived as real and can be just as distressing and debilitating as physical pain with a clear anatomical basis. Common examples of psychogenic pain include somatization disorder, where individuals experience a wide range of physical symptoms that are believed to be rooted in emotional distress or unresolved psychological issues, and psychogenic or psychalgia pain, which can be localized or diffuse and associated with emotional states. Treatment for psychogenic pain often involves addressing the underlying emotional factors through psychotherapy, relaxation techniques, and stress management. Cognitive behavioral therapy, CBT, is a common approach to managing psychogenic pain. Psychosomatic pain. Psychosomatic pain, on the other hand, refers to pain that is believed to have both psychological and physical factors contributing to its onset, maintenance, or exacerbation. While psychosomatic pain has a psychological component, it doesn't necessarily mean that the pain is purely psychological. It may have an identifiable medical condition or pathology as well. The psychological component, which can involve stress, anxiety, or emotional distress, is thought to interact with the physical condition, influencing the perception and experience of pain. For example, stress may worsen the pain associated with a physical injury or illness. An example of psychosomatic pain might be a person with a chronic medical condition like fibromyalgia who experiences increased pain during times of emotional stress. Treatment for psychosomatic pain typically involves a multifaceted approach that addresses both the physical and emotional aspects of the pain. This may include medical management for the underlying condition and psychological interventions to manage the emotional factors contributing to the pain. In summary, psychogenic pain is primarily attributed to psychological factors without a clear physical cause, while psychosomatic pain acknowledges the presence of both psychological and physical components in the pain experience. Understanding the nature of the pain is crucial for developing an appropriate treatment plan to address the underlying factors and alleviate the pain. Are psychosomatic symptoms harmful? Psychosomatic symptoms themselves are not inherently harmful. However, the impact and consequences of psychosomatic symptoms can be significant, depending on various factors. Here's a more nuanced explanation. Distress and impairment. The distress caused by psychosomatic symptoms can be very real and debilitating. These symptoms can interfere with a person's daily life, work, and relationships, leading to a reduced quality of life. Misdiagnosis and overtreatment. Psychosomatic symptoms can sometimes lead to a cycle of unnecessary medical tests and treatments because individuals may believe there's an underlying physical cause. This can be financially costly and expose the individual to unnecessary medical risks. Delayed diagnosis. In some cases, psychosomatic symptoms may overshadow underlying medical conditions, delaying their diagnosis and appropriate treatment. Healthcare providers need to be diligent in ruling out physical causes of symptoms. Chronic pain and suffering. Chronic psychosomatic pain can cause long-term suffering. Conditions like fibromyalgia or irritable bowel syndrome, which have a psychosomatic component, can lead to ongoing pain and discomfort. Impact on mental health. Psychosomatic symptoms are often associated with psychological distress and conditions like anxiety and depression. Left untreated, these psychological conditions can have long-lasting effects on mental health. Ineffective coping mechanisms. People with psychosomatic symptoms may develop ineffective coping mechanisms, such as avoidance of activities or excessive medical consultations, which can perpetuate the cycle of distress and impairment. Social isolation. The symptoms can lead to social isolation as individuals may withdraw from social activities and relationships due to pain or discomfort. Reduced work and educational functioning. Psychosomatic symptoms can affect a person's ability to work or perform well in educational settings. This can lead to career and educational setbacks. It's essential to understand that psychosomatic symptoms are not consciously fabricated. Individuals genuinely experience these symptoms. However, effective evaluation and treatment can help manage these symptoms and address the underlying psychological factors contributing to them. A comprehensive approach that combines medical evaluation, psychotherapy, and lifestyle adjustments is often effective in managing and alleviating psychosomatic symptoms. In many cases, recognizing and addressing the psychological factors contributing to the symptoms can significantly improve a person's overall well-being and functioning. Psychosomatic symptoms should be taken seriously, and individuals experiencing them should seek appropriate care to address both the physical and emotional aspects of their condition.